An illness striking children in new ways. It looks like the average cold, but this virus, EV-D68, sending children to the hospital at a rapidly high rate. As we first reported to you on Wednesday, now we have cases confirmed as close by as Dayton and Columbus, and it's not holding back, spreading across the country, possibly into the tri-state.
EV or enteroviruses typically bring on symptoms like a very intense cold. It often peaks in September. It has symptoms similar to asthma with an added runny nose and coughing. That's what you need to look out for. What's unusual is the number of hospitalizations.
52 patients went to the ER in central Ohio each day last week. Nationwide Children's Hospital in Columbus reports a 20% increase in patients with respiratory illnesses. Samples are being tested to determine whether EV-D68 is behind the spike. The Hamilton County Health Department reported no confirmed cases, but warns it is close and these viruses spread quickly.
All right, this map shows active clusters of the viruses in 10 states total, including Ohio here. It's also in Colorado, North Carolina, Georgia, Missouri, as many as 30 kids in the hospital per day in Kansas City. This is what has parents and doctors on high alert with possible cases here in Ohio. Carol?
Well, the question, Julie, is what's a parent to do? 9 on your side's Tony Moronis is here now to keep it all in perspective.
The information of a respiratory virus going around the country had me concerned as a parent. I have 3 young boys, and I thought I'd ask other parents about what their concerns are and what they really want to do about protecting their kids. Enjoying a day at the park.
Sophia, come back up this way.
Rose White tries to keep her little ones safe, but she understands sickness is harder to prevent.
It's a natural thing. Kids get sick, catch colds, and they move on.
When White learned about the respiratory virus putting kids in the hospital, she didn't get too excited.
I was just see how long it lasts, and if it lasts more than a day or so, that's when I get serious. I might go to the pharmacy and see if I can find something.
Dr. Derek Wheeler at Children's Hospital Cincinnati said this virus isn't new, but he has called in extra staff to help with more than 500 patients.
This has been unprecedented. This is something that we have not experienced before.
Cases of the virus are confirmed as close as Columbus and Dayton, and doctors will be testing for it here soon.
The surge has been mostly respiratory in nature, so a lot of our patients are requiring frequent respiratory therapy treatments.
Washing little fingers and hands is the best prevention, and keeping them out of their mouths. But good luck with that.
You know, it's not impossible. It's something that you know that you have to look forward to doing when it comes to kids.
Ultimately, you have to be vigilant as a parent, but what it boils down to is kids are going to get their hands dirty and they're going to end up in their mouths. So just keep them clean and hope that your kids listen to your instructions. Tony Moronis, 9 on your side.
All right, Tony, thanks for that report. Now, to show you how quickly this can spread, in Kansas City, one hospital has treated 475 patients. At least 60 of them went to intensive care.
My head started hurting after my lungs started sort of closing up.
That is 13-year-old Will Conejo, who is being treated for the virus in Denver. At least 900 patients have already been treated there.